Hi, my name is Rayvon. I am the nurse in the ER. Mr. Wilson's son, whom he lived with, brought him in because he was showing signs of a stroke. He's a 62-year-old male. Um, he's showing signs of aphasia, slurred speech, right arm and right leg weakness. We administered TPA within 1 hour of the onset symptoms. After administering TPA, we did notice that the aphasia and the slurred speech did improve. Um, he doesn't have any known allergies, no past surgeries, or no past stroke history. He does have a history of hypertension. He's currently on lisinopril, and he also takes Tylenol when needed for a headache. He's alert and oriented times 4. Blood pressure is 166/84. Respiration of 16. Pulse of 72. And 98% room air. We did do a neuro assessment, and he's still showing right arm and right leg weakness. So we're going to be bringing Mr. Wilson up. He's going to be admitted to the hospital. Doctor want to look over him for a few. We are keeping him calm. We are monitoring his vital signs every 15 minutes. And we are seeing some improvement after the TPA. If you have any questions, just let me know. We will be bringing Mr. Wilson up.
Hi, thank you, Rayvon, for the report. Hi, Mr. Wilson. I'm Nicole. I'm going to be your nurse today. I'm going to take good care of you. So I hear that you had a stroke. I'm going to get your vital signs and do a quick neural assessment on you if that's okay. So after assessing Mr. Wilson's mental status, which his memory, attention span, perception, orientation, and speech, also assessed his sensation and perception, his motor control of his upper and lower extremity movements, his swallowing ability, nutritional and hydration status, his skin integrity, activity tolerance, and bowel and bladder function. Mr. Wilson still has right-sided weakness of his upper and lower extremities. His speech is still slurred and still showing signs of facial aphasia. His vital signs is blood pressure is 150/80. His pulse is 64. His respiratory rate is 16, and his pulse ox is 98%. We're going to continue you, Mr. Wilson, on your lisinopril. This will lower your blood pressure, and the Tylenol for your hypertension to continue. And we're going to continue to assess Mr. Wilson for impairment of function with his daily activities. We are also going to start you on a statin. This will reduce the risk of stroke and lower your cholesterol so you don't potentially have another stroke. We're also going to put you on a heart monitor to monitor your heart rate and your heart rhythm. My nursing diagnosis for Mr. Wilson today would be impaired physical mobility. Mr. Wilson, I see that you're a Christian. Would you like for me to arrange for a priest to come in and pray with you and speak with you? All right, great. I can have that set up for you. Any other cultural considerations that you would need today? All right, no. So, Mr. Wilson, I'm going to contact the nurse educator to come speak with you. Her name is Taylor, okay? All right.
Knock, knock. Hi, Mr. Wilson. My name's Taylor. I'm the nurse educator. I was just going to go over some education for when you go home and anything you need help with. Is it okay if your daughter Amina is here? Okay, good. All right, so we're going to go over some stroke education. I just wanted to let you know of different ways you can help prevent a stroke, and this consists of eating a healthy diet consisting of low fats, low cholesterol, low salt, and high protein and high fiber diet. If you have high cholesterol and high blood pressure, it can increase your chances of having another stroke. You also want to make sure that you are maintaining a healthy weight for your height and are staying within that range. You should be getting about 2 hours of exercise in each week, whether it's walking or doing some sort of light activity to get you active or moving. You also will want to limit any smoking or alcohol intake, as these can increase your chances of having another stroke.
Should we make any changes around the house?
When you go home, it would be best to have some support system at home. See if your family can help out whenever it's needed. You also should get rid of any throw rugs that you have at home, as this can help with fall prevention. You could consider putting grab bars in the shower and by the toilet seat to better assist you. and maybe consider moving some things if you have them upstairs to avoid going up the stairs, as can help with falls too.
Do you think we can get any at-home help?
If you need any other support systems, we can arrange that. If you're worried about it being too much with your family, there are things we can help you get assistance with, like Meals on Wheels, transportation services to doctor's appointment or grocery stores, a facility you can go to during the daytime to be around others and participate in activities, and any other home services. If you need help with care at home or a rehab facility, we can get the social worker to help assist you with that.
Okay, thank you.
Thank you, Taylor. Hi, Mr. Wilson. This is Darlicia, and I'm going to be your physical therapist. Okay, so today I want to speak to you about the services we will provide to you as part of your stroke recovery. So, Mr. Wilson, please feel free to if you have any questions, please ask them, and I will be more than happy to assist you with that, okay? You and your family, you're going to be a really important part of this recovery process for yourself, so at any time, ask any questions, okay? All right, so based on your assessment today, there is no evidence of any sensory changes, but you do have some impaired physical mobility, and that's due to the paralysis and the weakness on the right side of your body. I'm sorry. All right, we call that right hemiplegia, which occurs when the left side of your brain has been damaged by the stroke. Therefore, everything on the right side can be affected. Okay, so our goal as your physical and occupational therapist is to strengthen your muscle tone and to get you to a level of physical independence or somewhere within the limits of your impaired muscle function. Just to let you know, though, this condition may be temporary or it could be permanent. Because you are having occupational and physical therapy does not mean that this is a cure for you. We are just here to help you achieve the best possible quality of life after your stroke, okay? We do have hopes that you will recover, though. Occupational therapy will provide, I just want to give you a background of what each will provide to you. So occupational therapy will provide a more holistic approach to help you reach your goals with basic activities of daily living, like feeding, grooming, bathing, cooking, driving. Also, with range of motion to help your muscle strength and your tone, cognition skills, movement, and mobility. Physical therapy and occupational therapy go hand in hand. So therefore, physical therapy focuses more on the movement, such as your strength and endurance, your walking, coordination, or help with any other problems, such as getting in and out of the car, which occupational therapy can help you with as well. All right, so with that being said, Mr. Wilson, do you have any questions for me? Okay, no questions? Great. Well, Mr. Wilson, it's been very great talking to you today, and I'm hoping you a full recovery. And we want to get you started as soon as possible on your physical therapy, and we're hoping for tomorrow. Okay, but with that being said, I'm going to send you to Jackie. Jackie is going to provide you with social services that will assist you in your recovery in the hospital as well as outside of the hospital. All right, so again, thank you for your time, and you have a very good day. Go ahead, Jackie.
Hi, my name is Jackie, and I am Mr. Wilson's social worker. Mr. Wilson, I received a report from Amina and the rest of the healthcare team about your condition, and it appears that you may need some assistance from me. As far as rehabilitation, there are multiple rehab facilities that assist with slurred speech and having weakness of the arm and leg. I believe in your case, we should do physical and occupational therapy and speech therapy also. We will need to discuss your finances and insurance to make sure that you're getting adequate care without putting yourself into any type of debt or anything. I will provide you with a list of the best places close to your home so it isn't a far travel for you, and we will go from there. Now, as far as a support system for you, it's very important to have a support system because it improves results and it promotes overall health and wellness. Now, having a support system will help motivate you in reaching your goals, and it'll also help promote independence as well. let's see. If you don't have a support system, there are individuals in groups that we can talk with to help guide you through your experience. As far as spiritual assistance and cultural considerations, Mr. Wilson, what is your spiritual background or your religious preferences? Along with your cultural considerations, I will be sure to incorporate all of this into your plan of care. Now, doing so will also promote healing and overall wellness for the mind, body, and spirit. In regards to transportation, do you typically drive or do you normally have people drive for you? Let's see. This is important to know because it's going to ensure that you'll be able to get to your appointments in a timely manner without any issues at all or any trouble. Transportation also promotes independence and will get you from point A to point B. Now, if transportation is an issue, there are resources available to assist you with no trouble at all. If you have any questions for me or any comments or concerns, please feel free to reach out to me and I'll be glad to assist you. Thank you.